This is GAO's Watchdog Report, your source for fact-based, nonpartisan news and information from the U.S. Government Accountability Office. I'm Holly Hobbs. During open enrollment this year, more than 23 million people enrolled in health insurance plans offered through federal or state-run marketplaces. While consumers can enroll independently, many seek free assistance from agents or brokers to help them navigate coverage options. But recently, federal fraud cases have highlighted concerns that some of these agents and brokers may not be licensed and could be costing consumers money through unauthorized changes to plans. We'll learn more about this issue from GAO's John Dicken. John, thanks for joining us.
Thank you.
So, John, let's start with, why would someone pose as a health insurance broker or agent? What do they have to gain?
Yeah, brokers and agents are not paid by the consumers that are buying insurance, but they are getting commissions and other payments from the health plans that are selected. And so often those could be $20 or more per each enrollee per month. And so over time, there could be significant commissions associated with individuals enrolling in a plan.
Do we know how often this is happening?
We saw that there were an increasing number of complaints to CMS, that by 2025 there were nearly 300,000 complaints to CMS that there had been unauthorized either enrollments or changes in health plans by brokers and agents on behalf of consumers. We also had done our own investigation and found at least 160,000 cases of unauthorized changes by agents and brokers.
There was a recent case of this, right? What happened?
Both CMS and the Department of Justice recently came to sentencing a large activity by unauthorized brokers and agents where they had used identities for thousands of individuals, often homeless or low-income individuals, and enrolled them in plans and changed those plans frequently to get those commissions.
So they're getting this commission off the health insurer, but what's the impact to the consumer?
For a consumer who is hoping to be enrolled in a plan or believes they were enrolled in a certain plan, they may not know that there's been a change. But yeah, it may affect their taxes when they're submitting their taxes, or when they try to get health benefits and have prescription drug or a physician visit, and the health plan coverage is not what they had expected.
So if I'm enrolling in one of these federal or state-run health insurance marketplaces, I'm looking for insurance, are there some red flags that I should look out for to know whether the agent that I'm working with or the broker is legit?
Most individuals are working with agents, brokers, most of whom are providing services on behalf of the consumers and getting their consent. But yeah, I think some of the red flags, there have been marketing practices that may offer even payments or indicate that there could be guarantees of no premium payments for the individual. And so it's important to verify information that they may be sharing on healthcare.gov that will be publicly available about the health plans.
Some of these marketplaces are run by the federal government and some are run by the states. Who's responsible for ensuring that the agents or brokers are certified or whatever they need to be there?
For the federal government, HHS and the Centers for Medicare and Medicaid Services have primary responsibility for overseeing the marketplaces where individuals are getting health plans. In some cases, states are directly running their own marketplaces, and in all states, states are responsible for licensing agents and brokers. And so it's a shared responsibility between the federal agencies and state insurance departments.
So we've seen concerns about this. Has CMS taken action?
CMS has taken some actions. They have tried to clarify the consent that consumers are providing and how that's documented. They've also, in some cases, required that if a new agent is involved in making a change, that there might need to be a three-way call where the individual, the consumer themselves, the agent, are both on the phone with the call center representative before that change can be made.
What about the states?
We looked at several states that are running their own marketplaces. So in states like California, New Mexico, and Georgia, there's more limited access that agents can have if they're not the primary agent to the information for consumers. And they often will require confirmation, such as a one-time passcode, to ensure that the consumer is aware of changes that the agents or brokers may be making.
So this is still a concern. Are we recommending that CMS take action?
We do have recommendations for CMS and are recommending that they take more action to assure that unauthorized changes are not being made. Some of that would require more verification of the individual's consent. It could be a one-time passcode that the individual has sent to assure that they're aware of changes an agent is making, and also to limit the availability of information to agents and brokers only to those agents that are directly involved with the consumer's enrollment as their primary agent or broker.
Last question. What's the bottom line of this report?
Yeah, certainly for the 23 million Americans that have been enrolled in marketplace plans, most are relying on agents or brokers to help them in making their enrollments and plan decisions. But unfortunately, we've seen thousands of cases where there were fraudulent or unauthorized changes made. And so we're recommending CMS take further steps to try to prevent those unauthorized changes to ensure that individuals are getting the health plan coverage that they consent to.
John, thanks for your time.
Thank you.
And thank you for listening to the Watchdog Report. To hear more podcasts, subscribe to us on Apple Podcasts, Spotify, or wherever you listen. And make sure to leave a rating and review to let others know about the work we're doing. For more from the Congressional Watchdog, the U.S. Government Accountability Office, visit us at gao.gov.